comfortable for you. What you want to do is you want to put your arm above your head like this, and you want to start from the armpit and work your way down. Just kind of do circular motions like this, and just make sure you feel for any types of bumps on the way down. You want to cover the whole breast, and you just kind of want to go in a circular pattern all the way across, working your way towards the nipple. When you get to the nipple, you want to squeeze it, make sure no discharge comes out, in the same way laying down. You put your arm above your head, you want to elevate your back, and you want to make it go flat by putting like a small pillow right there. Starting from the armpit, work your way down, circular motions, make sure you cover the entire breast, and when you get to the nipple, make sure there's no discharge coming out. If you find anything that's abnormal for your body, make sure you call your physician right away and get a more thorough exam. Will you repeat some of the steps back to me, please?
Raise your hand above your head. Work from your shoulder down around your breast in circular motions, and squeeze your nipple to see if you have any discharge.
Okay, and if there's any kind of abnormalities, make sure you call your physician, okay?
Yes.
Now I want to go to the cardiovascular system. So I'm just going to palpate. Make sure there's no any kinds of heaves or masses. Good. So now I'm just going to auscultate the valves. The heart is located between the second intercostal space and the fifth intercostal space. I'm going to start at the aortic valve, which is at the second intercostal space on the right side. Then I'm going to move over to the pulmonary valve, which is at the second intercostal space on the left side. And I'm going to move to the Earth's point, which is at the third left intercostal space, just left of the sternum. And then I'm going to move to the tricuspid valve, which is at the the fifth intercostal space at the end of the sternum. And then the mitral valve, which is at the fifth intercostal space at the left mid-clavicular line. And then muscle for the apical pulse, which is at between the fourth and fifth intercostal space at the mid-clavicular line. Good. No types of murmurs or thrills indicated. So now we're going to move to the posterior thorax. You can take a deep breath for me, sir. Okay. Posterior thorax is bilaterally symmetrical. Both sides rise and fall with inhalation and exhalation. So now I'm just going to auscultate the lung fields. I'll listen posteriorly first for a full respiratory breath. Make sure there's no signs of crackles, bronchi, or wheezing. I want to hear clear sounds all the way throughout. I'm also going to listen laterally. Good, lung fields are clear. So now I'm just going to move to the upper extremities. I'm just going to inspect. No signs of edema, urethra, or lesions. I want to check for capillary refill. Fills within 3 seconds. No types of clubbing indicated. So now I'm going to feel for temperature. Temperature is staying throughout the hours. Now let's see if there's any types of trigger. No trigger indicated. Skin is moist. So now I'm just going to palpate for the radial pulse. Pulses are bilaterally symmetrical. Now I'm just going to feel for the brachial pulse. Pulses are bilaterally symmetrical. Now I'm just going to check a range of motion, so if you could just follow me. Stick your arm straight out, flex, and out, and above the head, and down. Good. Patient's range of motion is good. Now I'm going to test for straight. So just push up on my hands. Good. And just push down. Good. Patient's strength is good. So now I'm going to check for neurological sensation. This is dull, and this is sharp. I want you to close your eyes and let me know which one you feel, okay?
Dull, 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 sharp.
Good. Patient's neurological sensation is good. So now I'm going to check for reflexes. I want you to relax as much as possible, okay? Your tricep. Your bicep. Your brachial radialis. Now I'm going to go to this side. Tricep. Bicep. And brachial radialis. Good. Patient's reflexes are good. So now I'm just going to move on to the abdomen. So if I could just have you lay back down on the bed. Comfortable? Okay. I want you to take a deep breath and just let it out. Contour is smooth and flat. I'm just going to inspect for any types of masses or lesions on the outside of the stomach. I'm also going to auscultate for bowel sounds. Bowel sounds can be hyperactive, hypoactive, audible, absent, or none. You have to listen up to 5 minutes for you to indicate a absent bowel sound. What I'm going to do is I'm going to start at the right lower quadrant and kind of work my way clockwise. Okay, bowel sounds indicated in all 4 quadrants. Now I'm just going to lightly palpate your stomach. If you feel any types of tenderness, please let me know. Okay, no tenderness in any quadrants. So now I'm just going to move on to the lower extremities. I'm going to inspect. No signs of edema, erythema, or lesions on the external surface. I want to check for capillary refill. Goes within 3 seconds. Good. Now I'm going to do the patient's range of motion. I'm going to move your legs, so just try to relax, okay? You have flexation, and right here for your popliteal pulse. Good. Extension, adduction, abduction, and adduction. I'm going to do the same exact thing on the other leg. So you have flexation, and right here I'm going to go for the popliteal pulse. Extension, abduction, and adduction. Now I'm going to test the patient's strength. So if you can just rise your leg up, here's my hands, and lower it against my hands. Good. Same thing on this side. And up. And down. Good. Patient strength is good. So now I'm just going to check the pulses. I'm going to start with the dorsalis pedis. Pulses are bilaterally symmetrical, and now move to the posterior tibial. Pulses are bilaterally symmetrical, and now move on. The femoral would be right here. Alright, check for the popliteal pulse. We're going to do flexation. I want to check for neurological sensation while the patient is laying down. So, sir, this is dull, and this is sharp. Just close your eyes and let me know which one you feel.
Dull, sharp, sharp, dull.
Good. Patient's neurological Neurological sensation is intact. I'm also going to check your plantar reflex. Good. And good. I'm also going to check your colonus. Good. Good. Colonus is good. So now I'm just going to have you, will you sit back up for me, sir, and face me? Okay, I want you to check for your patella reflex. Good. Good. I'm also going to check your Achilles reflex. Good. Okay, and that completes our assessment. Do you have any questions for me, sir?
No, thank you.
All right, thank you for coming in today.
Thank you.